All right, and I will screen share and we will get going. So again, welcome everyone today to the first part of our new TTAS series on evidence-based strategies. Today, we're going to be talking about social norms marketing campaigns. Just to briefly go over some of the learning objectives that we have today are that we're hoping that participants will increase their knowledge of social norms and social norms marketing campaigns, assess their capacity to implement a social norms marketing campaign that addresses their goals and priorities, learn the steps to develop a logic model for creating and designing a social norms marketing campaign. You're going to receive a template to use in developing a social marketing plan and logic model, and learning some tips on evaluating the impact of your social norms campaigns. Just put this in this slide together, some things here in Connecticut, for those of you who are from the state. I know we do have some people from out of state, but just some state level and some local examples of some awareness campaigns or social norms marketing campaigns that you may have seen. So we've got some things here from gambling, change the script, some local examples. So just put these up here to give you an idea of some of the things across the state that we've seen. As we get going, I just want to make sure that everyone has a common language that we're sharing today so that we have an understanding just what are social norms, what's a social norms marketing campaign, and what's an example of some awareness campaign. So there's some differences here. And along the way in this presentation, we're really trying to give you some examples of things as we go along, not just definitions, to put them into context. So what is a social norm? Refers to a pattern of behavior in a particular group, community, or culture that's accepted as normal, into which an individual is expected to conform. So I have an example in here, maybe a negative social norm would be, for example, kids should learn how to handle drinking alcohol before leaving for college. Conversely, a more positive social norm might be that your community demonstrates a large percentage of parents who have disapproval of underage drinking. So what is the definition of a social norms in marketing is the use of evidence-informed marketing campaigns to educate individuals on positive social norms with the goal of correcting any misconceptions or perceptions and decreasing undesirable behavior or increasing desirable behavior in norms.
Yeah.
Ooh, that's somebody who's not on mute. Sorry, thank you. If you could stay on mute, that would be helpful. Thank you. Social marketing is a useful method that relies on research about the audience or your priority audiences, as well as established sociological theories to guide your messaging and tactics that encourage positive and voluntary attitude and behavior change. Social marketing campaigns are evaluated for both how they're implemented, efficacy, and effectiveness. So the impact that you're making using this strategy. Exposure to high quality social marketing campaigns effectively changes perceptions, attitudes, and behaviors. For an example we might see is something like 55% of 12th graders in our community report not drinking alcohol in the last 30 days. So parents, make sure you express your rules on underage drinking and consequences for breaking them. The difference between a social norms marketing campaign and an awareness campaign. So sometimes these get a little commingled, but an awareness campaign really aims to educate a specific population on a matter. So an example might be to educate adults and parents on Connecticut's social host law. Awareness can be a part of both social norms and social norms marketing campaigns. So awareness campaigns are really raising an awareness of an issue and seeking to educate the public, whereas a social norms marketing campaign is not only raising awareness and education, but seeking to change attitudes, misconceptions, and behaviors. So I hope that kind of clears up those differences in those terms. Just a brief slide here on the strategic prevention framework, which I'm sure many of you on the call today are well aware of, but we'd like to go over the SPF in the context of this presentation and all of the presentations that we do. So just the 5 steps and 2 guiding principles of the SPF offer prevention planners a comprehensive approach to addressing and understanding substance misuse in their communities and related behavioral health issues. There's 5 steps. And it'll be similar as we go through this presentation. on implementing a social norms marketing campaign, but assessment is you're identifying your local prevention needs and identifying what your problem is. Capacity, building your local resources and readiness to address it. Planning, finding out what works to address prevention needs and how you're going to go about doing that. Implementing is delivering your evidence-based programs, practices, activities. That's really putting your plan into action. And an evaluation is examining the process and outcomes of the programs and practices. Undergirding the SPF are two principles, cultural competence and sustainability. And we will get into each of these as we go along today. So now we're going to go into a little bit more of the meat here on organizing and conducting a social norms marketing campaign. So a social norms marketing campaign, again, involves several steps with the goal of positively influencing or changing attitudes, behaviors, and beliefs. So similar to the SPF, the first step would be defining your problem. And here you're looking at your risk factors and your protective factors that are contributing to the identified problem. So an example that we might see as an issue that many communities or organizations, at least in our state, work on in terms of substance abuse might be addressing underage drinking, looking at peer norms that are accepted, or access to substances. Next, you're identifying your priority population or the audiences that you really want to speak to in your social norms marketing campaign. So who is affected and who is it really feasible for us to try and reach based on the goals that we have? So this may include the people who are demonstrating the positive norms and those that you are looking to alter any misconceptions or behaviors or attitudes. So an example might be, we want to look at youth from age 12 to 20, or we want to target parents with some education and awareness campaign materials, or maybe we want to look at retail and merchants. And so compliance checks, things like that. So just identifying your audience or audiences in your campaign. Next, similar to the capacity step in the SPF, we're looking at our readiness to implement a social norms marketing campaign, engaging with partners in our community or outside of our community even sometimes, who can help us and assist with us and who are really engaged with us and care about the outcomes that we're looking to address in our campaign. And in this step, we just want to be mindful of ensuring that we're building in some cultural competency and sustainability while we're designing our campaign. So who are those populations that might be harder to reach in our community? How can we ensure that we're bringing them to the table with us to get their input and feedback? And how are we designing our plan for sustainability after it launches so that it can be successful for the long term? After you've done that, you're looking at creating an implementation plan, including developing your core messages and your communication channels. Examples that you might want to be looking at in terms of an implementation plan would be things like your funding, timing, what is a key time in your community to be launching something, looking at your calendars, dissemination plan, who are you going to be contacting to share your social norms campaign, who are you going to be partnering with, informing key stakeholders along the way, and making sure we're getting a lot of feedback as we develop our messaging and our materials. And we're going to go into each of these steps a little bit more as we go along, so a little more detail, but just wanted to outline the steps on this slide for you guys. Next is you're implementing it. So this is when you go to launch and you're all ready and you're out there and you're doing the activities and sharing those materials of your campaign. Really important here to follow the plan that you've worked so hard on until this point to implement your social marketing campaign as you've designed it, as you've collected that feedback, and as you intended it to be. And then finally, you're going to assess the impact of your campaign, such as changes in the attitudes or behaviors that you hope that it would achieve. Some examples around evaluation, which we will also get into later, is looking, did you increase knowledge of the social host law? Did you decrease 30-day use? Were you able to increase peer disapproval of a certain substance? So those are just some examples of evaluation metrics that we'll share some more later on as well. So really the point of the evaluation step is what metrics are you going to be using to evaluate the impact of your campaign? One thing to consider is working with a marketing partner, perhaps. So certainly working with a marketing partner on your social norms campaign is not a requirement to conducting a successful social norms marketing campaign, but it might be something that you want to consider or look into. But so on this slide, we're giving you some ideas on things you should include in assessing whether you're going to use a marketing partner or not and what to look for. So just, there are definitely some benefits to looking at partnering with a marketing partner. So they can help you conduct research. They can help you hone in on your messaging to the target audience that you're seeking to reach. You might check on their portfolio. Have they done prevention marketing social norms campaign before? Perhaps ask for a reference from the prevention field if they have done so. Ensure that they're really familiar with your community, what will work well with your community, including understanding your priority populations and the substances that you're looking to hone in on. Also ask about their capacity of their timeline. Are they able to do the work on the timeline that's working for you and that you're hoping to deliver on? And also just what are the resources that you have in working with a marketing partner? What do you think that you might need fiscally, material, and human-wise in order to implement your campaign? But again, so, you can market with a partner. There are some benefits. I know I've done that in the past as well. And sometimes there are people on your coalition that have a marketing background, or you might know someone in your community that is really invested in your community and the goals that you're working on that would be happy to work with you and partner with you on helping you create your campaign. Sometimes you can get marketing partners that will work with you on a pro bono basis or perhaps on a reduced rate. So this is just one option that we wanted to include, that something to think about as you're looking to develop a social norms marketing campaign. Certainly, again, you don't have to use a marketing partner in an official capacity, but we did want to include some ideas on other ideas if you choose not to use a marketing partner. You can always utilize or borrow existing campaigns that exist on the state level and even on the national level, because they certainly do exist, and perhaps tweak them with your own data and maybe some of your own messaging. But just a reminder to always cite your materials if you're borrowing them from another source. Of course, there are plenty of publishing platforms that we know of that people utilize in creating materials for marketing, such as Canva or Adobe, the publisher. Anne, I'm going to ask you.
Right. Okay. I'm sorry. I just came on the Zoom and now.
Thank you. Again, recruiting coalition members or even youth to assist in creating campaign materials. We have youth committees, or we have youth members of our coalition, youth peer advocates, and they're great at messaging, and they're also great at some of the technology. So we would definitely encourage you to reach out to youth members of your coalition or your community, maybe high school students who are taking a design class that might be willing to help, and give them some volunteer hours, what have you. So I have found in my experience that youth are great at helping in this area. And again, just reaching out to your local businesses to see if they would assist at a free or reduced rate. An example might be maybe there's a printing little company in your town or nearby. Maybe they would help you with some of your printing if you're going to be doing any print materials. So just some ideas on here on alternatives to using an official marketing partner. So let me just stop right there really quickly and check in with Shay. Do we have any questions, or does anybody have a question? If you can use your hand raising emoji before we move on to our next section on logic models. I don't see anything in the chat.
There's nothing in the chat right now, Jen.
Okay.
But if anybody has any questions, feel free to ask.
All right. So now I am going to kick it over to my co-host today, Lisa Mason. And she's going to walk us through logic model development. Lisa, you there?
Good morning, everyone. One of the things that we want to keep in mind, no matter what we're doing in terms of prevention strategies, we want them to be grounded in a logic model that basically provides a roadmap and a rationale for what we're doing and why we're doing and what we hope to achieve. And social norms marketing campaigns are no different than any other prevention strategy. We want them to be couched in a logic model. And what we have here is a logic model for doing a social norms campaign, and that is couched in the larger prevention, the strategic plan that you're developing. One of the things we know is that prevention works best when we have multiple strategies that complement and reinforce each other. So social norms marketing campaign would be one prevention strategy within the larger logic model. And here's an example of the roadmap and the rationale for doing one. So it begins like all of our prevention work with data. And we're looking at what is the problem in my specific community. And the problem in my community is, for example, what's the underlying problem and what does the data say about that? So we want to make sure we have data that proves the case or supports the case for this. And so the example might be personal hazardous drinking problems. And so what does the data say? Or maybe it's vaping that we're looking at that we want to change. And so we want to know, what is the data around that? What does it say? You know, do we have a statistic around 30-day drinking, underage drinking, 30-day underage vaping, for example? And tied to that is the risk factors associated, because one of the things we're looking to change in prevention, we've got our long-term outcomes, which are the 30-day use, and our shorter-term outcomes are the risk factors. And in this case, it's often misperception of harm or misperception of how many people are using a substance that we want to change. Kids often have the misperception that more of their peers are using a substance. And parents sometimes have the misperception that more parents are serving, for example, underage kids. So we want to change that misperception of the behavior. And what are some other risk factors that are associated with that as well? For example, you know, are kids reporting that their parents disapprove, or are they reporting that their peers disapprove? So we're looking at not only what is the personal hazardous drinking pattern, what is the 30-day use, but we're also looking at what are the risk factors and the data needed. I've just mentioned what those are, the 30-day use and the risk factors. And then we pick an intervention strategy to change that. And so in this case, it's going to be a community-wide social norms marketing campaign. We want a campaign conform to social norms and principles that's going to reach the intended audience. So we're thinking about who is the audience, who has that misperception that we want to change, whose behaviors do we want to change, and that's who the campaign is going to be directed to. For example, if we want to change parents' misbehaviors, we're not necessarily going to design a campaign to kids. Kids' misperceptions or kids' misperceptions or behavior, we want to target it towards parents and vice versa for peers, for kids. So that's one of the strategies that we're going to check. Our intervention goal is to be able to correct that misperception of normative alcohol use behavior. So basically what we want to do is to change, we want people to adopt a specific behavior that's going to lead to that change in the 30-day use of alcohol or other substances. So what is the specific behavior? So one of the things to always be keeping in mind when we're developing a social norms is not only do we want to change beliefs and misperceptions, we want to do that with the idea that people will be adopting new behaviors. So for example, we may want parents to talk to their kids about what their rules are. We want parents to adopt to have a better understanding of the social host law so they do not serve. So they choose not to serve at underage parties. We may want a change in behavior where kids feel empowered to be able to speak out against underage drinking and be comfortable being substance free. So always thinking, what's the specific behavior behind this? And then the anticipated outcomes is going to be increased use of that protective behavior. The short-term outcomes, as I said, are changes in the risk factors. And the long-term outcomes are the changes in that 30-day use. With the desired impact that we are reducing alcohol-related consequences or vaping-related consequences. And so we've got an example of the data below for that. So again, we have a rationale for what we're doing and why, and this sits in this bigger logic model of our strategic plan, social norms intervention being one of the things that we're doing. Okay, next slide. Okay, as we said just a moment ago, collecting strong audience-specific data is necessary to develop and implement an effective social norms marketing campaign. The more you have information about the behavior, about the local conditions, the risk factors in terms of our community, the more data you have about your specific audience, the better, more effective the social marketing campaign is going to be, because it's really tailored to your specific audience, your target population. So some of the data that you're going to want to have is identify the problem in the population. And that's what we said, you know, what's the 30-day use? What are some of the behaviors that are occurring with alcohol use, for example? You know, where are we seeing kids doing this? Are they partying at home? Are they partying with parents' permission or not with parents' permission? How are they obtaining the alcohol? What do they believe about their peers? Drinking habits? Are they overestimating that? What are the risk and protective factors? And who's most affected by this problem? And who's most likely to change? And that's when we're looking at subpopulations too. Are there certain subpopulations that are more impacted by this? Say, for example, in one community, it could be athletes that might be more impacted by another. Maybe there's a norm in our community that we play hard and we play sports hard and then we celebrate hard in our community. Or maybe it's let me get this right, LGBTQ plus young people. Maybe they're using it as alcohol as a coping strategy for some of the discrimination or the stigma or bullying that they could be facing. So what are the populations? So we want our data to help us really understand the specific problem in our population. Then we're going to conduct some audience research, and focus groups can be really helpful for this if we don't have the data from our survey, or doing key informant interviews with specific people who know more about this. And it could be maybe coaches or advisors, youth service bureau people, maybe our school resource officer. Is there a youth officer that works, you know, in the police department, school nurse, pediatricians? Who are some of the people? The youth themselves. So what do they perceive as the benefits of underage drinking? What are the benefits of abstaining, of not drinking? Why are they choosing to be alcohol free? What are the perceived benefits and barriers of changing their behavior? Because we know often there's a there's a cost to changing the behavior. So what are those costs? And how might we make not using alcohol or not vaping more appealing? How ready is your audience to change? What's getting in the way? What are the costs? And what are their preferred channels of communication? What is what are the ways they communicate with each other, and what's the best way to reach them? For example, in one community, it may be the local newspaper that comes out every week, is read by a lot of folks. And so that may be something. There may be a huge Facebook page among parents in the community. Young people might be using Instagram. Those are just some different ways. Then design your message. What is the behavior you're hoping to encourage? What is it that you want them to do? And what are the perceived benefits and barriers to engaging in this message? And again, the more specific, the better. And you want to basically sum it up into a soundbite, if you can. A perfect example is the SAMHSA example, talk, they hear you. Because what's that saying is talk to your kids' parents about alcohol, and they're reinforcing the fact that parents are one of the most reported influences in not drinking that kids report. The importance of parents talking to their kids, setting the rules, enforcing consequences, and having ongoing conversations. So it may seem really short, but talk, they hear you is a great message. And that's a message that you're going to be able to vary and adapt in different kinds of products and different channels. So choose a single perceived benefit that we want to elevate and emphasize how it outweighs the barriers, and what simple, culturally appropriate language best demonstrates perceived barriers that can overcome. I know another community, I'm not sure if Ty is here, but when Ty Wiley was the coordinator of Windsor Locks, they did one called Have the Talk with your kids, short, to the point, and one that they could adapt easily. Hi, Ty. Ty's now with New Britain, but the idea, and she's a good person to connect with, but the idea, have the talk, and they grounded that in, there's all kinds of different things you do to protect your kids. You take them for their newborn vaccinations, you put them in a car seat, you teach them how to wear a bike helmet, you use seatbelts, and have the talk is one more thing that we do to protect our kids and keep them safe. And then what we're going to do, once we have specific message, we're going to select those communication channels. Based on our audience research that we did earlier, where do they get their news and information? And select those channels that are going to be most likely to reach our audience, and design a message for each platform. You're going to use that same theme, but you're going to be able to tailor that message. So perhaps you're going to use some social media posts, and then maybe you're going to, because you've got some billboards in your community on major roads that people drive by, you're going to adapt that visual and that campaign slogan into a huge billboard. And maybe you're in an area that doesn't have them. Maybe you're going to put it on some lawn signs, and you're going to time those lawn signs for a specific time that's relevant in your campaign. Maybe you're going to create a sticker that you're going to put on the front page of the local paper that goes out. And then you're going to have an op-ed that somebody from an opposite the editorial page that somebody is going to write up. So those are some examples of different products and different channels that you might use. And then you're going to implement your campaign. Your before you actually deliver these, you're going to use focus groups to test the message, to make sure it's getting across that they like it, that it's relevant, that it's respectful. And then you're going to fine tune the message. And you're also going to think about, how else can I support this? Maybe I'm doing this terrific example on social host messaging, and maybe to help people better understand, we're going to do a presentation on the adolescent brain and how alcohol impacts it, to give people more of a rationale. Or we're going to publish some information on our website, and we're going to direct people to that website to support this. And then lastly, what we want to do as we're delivering that message is measuring everything that we can. We want to collect both process data, what we're doing, how many people we're reaching, how are we implementing it, as well as the short-term and the long-term outcome data. You know, are we seeing those changes in attitudes, beliefs, misperceptions, risk factors? And then are we seeing the longer-term changes, the longer-term outcomes, the changes in use? Thank you. Okay, and we've created here is a social marketing logic model for any community coalition. And basically, this is a way for you to write down and record what it is that we were just talking about earlier. And the idea under situational analysis is you're looking at your data that really documents the 30-day use, the risk factors that are associated with that, and available. I hear my dog, excuse me, walking around the kitchen. Available resources. And so who do we have to work with within our community? You know, for example, it's the newspaper. You know, have we worked with them before? Do we need to develop a relationship with them? Is there somebody who's a good social media influencer that we can work with in our community? Is there somebody who maintains the community Facebook page? Can we talk with them about this? The PTO, maybe they're going to be somebody who's going to be helping to disseminate materials, or the superintendent. Maybe they're going to be doing email blasts about this to support it. So who are those resources? And then again, the goal, what is it we're trying to achieve? What behaviors do we want people to take? What misperceptions do we want them to change? And then we're going to have some objectives related to that. And the objectives are often related to our risk factors, and then the primary activities. And this is where we can really start to get in the nitty gritty, you know, looking at the messages, selecting products, designing those products, testing the products, delivering those or disseminating those, and then maybe any changes or new things we want to add to support the campaign. And then what are the specific outcomes? What is the impact that we're trying to have to change? And one of the things that I want to really encourage folks as they're working on their social marketing logic model, and creating campaigns, is there is tremendous expertise in this state. Social marketing campaigns have been going on for at least 10, 15 years in this state. There's lots of people who have done them well, and they could be mentors to you. And if you need names, if you don't have them, we can connect you with them as well. So you're not doing this by yourself. There's people to support you along this. And I think that's it for me, Jen. Thank you.
Sorry, I was muted. Thanks, Lisa, so much. Just so everyone knows, that sample logic model template will be a resource that we do email to you after the presentation along with the slides. So that's a fillable document that that will provide to you as a tool. So just circling back to some of the things a little bit more in depth that Lisa was just talking to everyone about. Right now, we're going to talk about who you can seek input from along the way and the importance of doing that and why it is. So just some examples here on this slide of people you may want to reach out to as you're developing and designing your campaign and testing your messaging out. Obviously, you're going to want to work with your organization members or your coalition members. Definitely reach out to your youth committee, your youth peer advocates, or just youth groups generally in your community that you might have access to test out any messaging and to get their input on any graphics or design. Again, I'll reiterate, I feel like they're a really great resource for all of us in doing social norms marketing campaigns. Definitely your community leadership. So whether that be your mayor, your first select person, your superintendent, just those key leadership roles in your community so that they're understanding what you're doing, why you're doing it, what the goals are along the way. School personnel as well. Maybe it's your health people, maybe it's your school counselors, maybe it's some club advisors. So just reaching out to some school personnel is another option. If you're including anything around enforcement, so merchant compliance, DUIs, social host laws, I'd encourage you to reach out to the enforcement sector, your police department, letting them know that what you're doing, seeing if they'll engage with you and partner with you on that and agree that it's important and be willing to participate in your campaign with you, as well as the other sector representatives in your community. Clearly, you're going to want to reach out to people within this list or outside of this list that really makes sense depending on your campaign, who you're trying to speak to, what your goals are. So certainly this isn't an exhaustive list, but just some ideas on getting you started. But the one thing, as someone who has done one in the past, is we don't want your campaign to be a surprise, right? You don't want to have key leadership or key community members not know what's going on, why you're doing this, and then all of a sudden things come out and there's all these questions and potentially some backlash or some concerns around it. So really, let's not make it a surprise. Let's make sure we're building consensus and understanding. Maybe some people might not want to necessarily agree with everything, but at least there's that understanding and that dialogue of the importance of what you're doing and why you're doing it. Sorry. At this point, we just put a slide in here on language choices. So we wanted to be cognizant in our campaigns and even outside of our campaigns, just in general in the prevention world, is being cognizant of the terms and the language that we're using. You know, stigma is one of the biggest barriers to treatment and recovery for substance misuse today. So often the language that sometimes we see in the media, especially sometimes, can be perpetuating negative perceptions. And so on this, we just give you some examples of stigmatizing language and possibly other choices that you might be able to utilize. So I won't read these all to you. Not sure why my dog's barking, but we'll move on from there. Now we're moving into launch and implementation. So you've done all of the work. You have done your consensus building. You've tested your messages. And you're ready to really go to that big day when you're ready to launch and implement your social norms campaign. So one thing I'd recommend is that you draft or have someone in your community draft a press release with a strong messaging with all the links to your materials. And in that press release, you might, give the title, maybe some pictures, links to everything, and just the aims and goals of your campaign. For the media, you can certainly decide which media outlets you feel fit best to share your press release with and connections to the materials. And perhaps you're going to couple that with a launch event. I know right now it might be a little bit hard to get a whole bunch of people together for a launch event, but you could also do a virtual one just to get that energy and that momentum out and get the word out about what you're doing and have a big kickoff to all this work that you've done and just get that enthusiasm and encouragement going. One thing I know I've done and I would encourage as well is to create a dissemination contact list before you go to launch. And that's just developing a list of who you're going to be sending your press release to and your materials once they're ready for launch. What sectors, what community organization, what groups have you partnered with, and just making sure that you have a really good, robust, comprehensive list of people that you want to get that, that word out to. Dissemination locations and events. So where are you going to put everything and what kind of events are you going to do around supporting your campaign and your messaging? So thinking about as you build that design and that logic model and your plan, Where are you going to place your campaign materials? Are you going to do them only online? Are you going to do them online and physical presence locations? What events might you be able to host that support the social norms campaign and support that sustainability of it going forward? Are you going to do it in person? Are you going to do them virtually? I give us some examples here of typical events that we might see that support a social norms marketing campaign. So oftentimes you'll see a group come together for a set of professional speakers, and you're going to have a panel, and you're going to have a parent night with professional speakers. Maybe you're going to participate in some tabling events where you have everything out and you're doing signups and you're recruiting for new membership. Maybe you're going to co-host and support another organization's event. Maybe Parks and Rec is having something that you could co-host or sponsor and have a tabling event at some of their events. Film screenings are pretty popular. Hosting some prevention screening that's related to your messaging and marketing coupled with a panel speaker. Maybe you're going to piggyback on some school events like back to school night or course selection night or conferences. And so just taking advantage and leveraging the opportunities that are already being planned in your community that you can piggyback on and incorporate what you're doing as well. Maybe you're going to build in some public trainings. Maybe you're going to do a Narcan training. Maybe you're going to do a mental health first aid. Maybe you're going to do a vaping training and a vaping presentation geared towards middle school parents. So all sorts of different trainings that you might be able to incorporate as well. Are you going to participate in drug take-back days and proper medication storage and disposal? Are we going to highlight our merchants that are partnering with us and those that are doing a really good job in being prevention partners in our community? So just a whole bunch of ideas here for you in terms of different locations or events that you might be able to incorporate as you plan, implement, and evaluate your social norms campaign. Again, just be mindful of incorporating items and events that incorporate our youth, always giving them the opportunity to present or be present when we're doing our prevention efforts. And also making sure that we're building in that cultural competency. Again, how are we going to reach those more underserved populations that Lisa was just previously mentioned, or that may exist in your community? And how are we going to make efforts to make sure that they are hearing what we're wanting to deliver as well? So what we did here, Lisa had mentioned, what platforms might you use? We've created a couple slides for those of us, just knowing the typical different social media platforms that people may be on, and thought it might be helpful just to give you a few slides on what some of those platforms are best used for, what kind of demographics usually are using them more than others, and just what their reach may be, so that you can really target where you might want to put things based on the audience that they are. I won't go into these, but it will be in the slides for you to reach. I'm sure many of you already know you want to use Facebook for this, or you want to use Instagram for that. But we include this diagram for your benefit on that, and as well as the next slide. Again, it's really about choosing the right social media platforms if you're going to be using social media, based on who is the intended audience, how are you going to be reaching them. Debate can vary based on the goals of your campaign. So this just is another kind of visual graphic that tells you a little bit about the demographics of each of these. What are they really best used for? And what are some of the potential limitations of their use? So then you can use something different based on those limitations. So I won't go to read these, but this is something that we thought might be helpful as you assess what might be the best places to put your materials. Shay, is there any questions so far? I just want to give a brief opportunity if there's any questions, or if anyone wants to raise a question now before we move on to evaluation.
Currently, I don't have any questions in the chat bot yet, so we're good there, Jen.
Okay, great. So now we're going to move on to evaluation. So really evaluation, I'm sure many of you are well familiar with the evaluation step of the SPF. And that's really evaluating your work to ensure that you're having the desired influence on the priority population that you identified way back in your assessment phase, way back when you were developing your plans for the logic model for your campaign. So really when we're talking about evaluation there of social norms marketing plans, there are really three key measures or ways that you can evaluate your plan. And those are outcome measures, process measures, and impact measures. So outcome measures are really looking for things like audience understanding, just getting feedback on your events, the type and tone of your media coverage. An example of an outcome measure, a simple one, might be parents increased their knowledge of the social host law by 6% as measured by a pre and post exit survey of attendees to the parent panel event. So maybe you gave out a little survey when they came in or took a poll on Zoom, how many people are aware? And then at the end, you took another one and did you change their knowledge? So that might be an example of outcome measure example. Process is where you're really looking at those impressions, your media coverage impressions, your social media engagement, your website views, maybe your video views. So everything that you put in your implementation plan of how you are going to disseminate the information, how did you reach them? How did you reach them? What are those counts? So an example of a process measure might be visits to the coalition website increased 10% post-campaign launch over a 60-day period. So we drove people to our website for our materials. We knew in May it was X, and then in July it went up so much amount based on driving traffic to that to our website. And I'm going to go into a little bit more later on, but just wanted to give you some easy examples on this slide. And then an impact measure. These are a little bit harder to impact. Some people have state evaluators or evaluation professionals that help them with impact. They can always be helpful in helping you with some of your impact measures, but we really are here changing that long-term change in behavior and attitudes that we really set out to do. So an impact measure may be 30-day use of underage alcohol by youth aged 12 to 20 decreased by 3% in a post-campaign student survey. So you're really measuring that long-term change that you're hoping to see in your impact. This slide gives you a little bit more on those process evaluation tools. So depending on your campaign and what you're doing, you may look at things like how many people came to our events. Are we looking at demographics? Did we really want to target a certain population and did they come? The number of materials we may have distributed. Did we recruit new members to the coalition? Did we increase our capacity? How many people went to our website? How many people visited our Facebook analytics? How much was our tweet reach? So these are all ideas on your process evaluation that you can really count and look at in terms of what your reach and scope and breadth of your campaign delivered. Outcome evaluation ideas are really, again, looking at analyzing changes in audience knowledge, attitudes, and beliefs. So audience understanding, determining if the audience changed their knowledge, attitudes, or beliefs over the course of your campaign. And an idea here is through pre and post campaign surveys, or those focus groups or key informant interviews. Student, parent, and community surveys. We knew a lot of organizations do student surveys, they do parent surveys, maybe they do a community-wide survey just to get input, and looking at those changes and results over time from before and after. You can use Google Forms. Those are easily ways to get some information and ask them questions. Also SurveyMonkey. A lot of people use SurveyMonkey. That's an easy resource that you can do in creating some surveys. Getting event feedback, either formally or informally, but really anecdotal, because qualitative data is important too. How are people feeling? What are they thinking about it? But just getting input on your events that you hold and were they beneficial to them in attending. Again, just driving home Lisa's messaging, always reverting back to that logic model and assessing, are we doing what we said we would do with fidelity? Are we implementing as we planned? How are we assessing those impacts? So again, having that planning ahead of time and that logic model at this point when you get to evaluation is so super helpful for being able to say, this is what we set out to do. Here's what happened. And did we meet that? And do we need to tweak it going forward? Because that's okay too. Maybe some things don't work out the way that you hope that they would. And you go back to the drawing table and reassess and how we might be able to change things going forward. So on this slide, I give you some examples of increasing knowledge and behavior changes addressed in social norms marketing campaigns. Clearly, this is not, an exhaustive list, but it's a good number of things that we tend to see coalitions or organizations working on through the use of social norms marketing campaigns. So just increasing awareness of social host law, increasing perception of harm, of certain substances, increasing knowledge of access to substances, proper storage or disposal, decreasing DUIs. Maybe we want to look at increasing our merchant compliance for underage sales. Maybe we want to work on home access, increasing knowledge of development of the youth brain and how substances impact brain development in youth. Working on increasing our protective factors in our community or decreasing our risk factors. Maybe like Lisa said, we're going to target some special populations. We're going to do something maybe around mental health. Maybe we're going to do something around building our coalition and engaging more sectors. So just a bunch of ideas here that we've seen social norms campaigns and awareness campaigns built around, in case people haven't done them and just looking for some ideas. And they also familiar pitfalls and challenges, right? Sometimes things aren't as easy as we might hope. So we did want to include a slide on what are some pitfalls and challenges that we've experienced in doing them or we've heard from other people. Just wanted to put those out there so that you can think about those ahead of time and build them into your planning. So just really going through some of these that are pretty important, not sharing the overall aim of your campaign. So that's probably pitfall number one, not sharing why you're doing this, what your goals and objectives are, what is the importance of that to your community. Not bringing leadership and key stakeholders along in the process and getting their input and feedback, not including your youth. Maybe there's a community that might not rather want to acknowledge that there's any issues in the community, or maybe there could be some political pushback on, painting the community in a negative light, when really what you're trying to do is actually just address issues that will actually end up benefiting your community. Not having resources, how we're going to work around that, the fiscal and human, how we're going to allocate the resources that we do have. Forgetting about smaller populations in our community, or not building in that cultural competency or sustainability into our planning. So, anyone have any questions on any of those things or any experiences? Happy to hear anything around those or any ideas other than what we put on here at this time before we move on to the next part. Nothing to share right now, right?
Nope, nothing in the chat right now.
Okay, so soon we're going to go into breakout rooms. We really wanted to provide a good amount of time for people to go into breakout session and start talking about their experiences if they have done a social norms campaign, so that others can learn from them. And also, if you haven't done one, that's okay too, to start asking some key questions or thinking about how you might go about them with those in the breakout room who might be able to lend you some experience. So when we go into breakout rooms, I have a list of questions here that I'd like people to start thinking about or talking about. You might want to jot some of these down before we go into them so that you have them. So if you've done one or if you haven't, what would be goals and objectives that you would think about doing a social norms campaign around? What are some activities that you think you could do or did do that you found were really helpful? Who did you seek input from, or who do you think you might need to look to in terms of getting consensus around your campaign and messaging? Who did you partner with, or who are some key stakeholders in your community that you might be able to engage as you look to developing one? Who or where are you going to disseminate your campaign to? And then finally, how did you evaluate your campaign and impact? What was the impact in meeting your goals and objectives? Again, just challenges and successes that people have experienced, or challenges you think you might run up into that others might be able to help you think about now as we're in breakout. And just finally, any last questions that you might have. So Shay's going to put us all into some breakout rooms. We're going to do this for about 20 minutes, and then we will come back and share some of our findings and take it from there. And I'm going to stop screen share.
All right, moving to breakout rooms now. No.
Nice.
Easy.
Okay. Okay. There.
No. No, come. Hey, Jen, do you want me to move you to a room?
Yeah, can you put me in room 3? I think they only have 2 people.
Okay. I was just checking to see. Okay, hold on just a second.
I can do it myself, actually, I think.
Yes, you can.
Thanks.
Yep.
Hi, you guys.
Hi, Jennifer.
Hi, Jennifer.
Hi, how are you?
And despite what it says, my name is Jane Ungeback. It is not Louis Mangano. That's the owner of our home computer.
Oh, you know what? You might want to send me an email too, just around that, because when I send out the CEUs, it's definitely based on the sign-in names.
Yeah, I don't care about CEUs.
Oh, you don't?
I'm getting
Okay.
ready to retire.
Oh, okay, great, no problem. All right, well then, Louis might get a CEU. I'll make sure I make a note of that. Okay. All right, so have you guys done social norms marketing campaigns yet, or are you thinking about doing one?
Okay, say where where you're from and what you're doing.
Sorry, I was on mute. I'm actually, sadly, I'm at home with COVID, so I'm coughing a lot, so I have to mute myself.
Sorry.
No, that's okay. But as I was telling Jan, right? Jane, I'm new to the position of prevention, very new, and I've not done a social norms campaign, so I'm quite interested in learning more. Part of my role since I started a couple of months ago is to really get our youth in Danbury, Connecticut activated into not only substance misuse prevention, but incorporating trauma and mental health with that, and how community issues have impacted what's currently going on, because there's always that underlying issue as to why we engage in negative coping. So the campaigns and marketing is very, very new to me in general. It's not anything I've ever been exposed to. So I'm excited to learn about it. But sadly, I don't think I can contribute anything right now because I don't know much about it.
You have a PCC grant, right?
We have a LPC grant and a DFC grant, and I oversee the Stand Together Make a Difference coalition here in Danbury.
Okay, great. So I have done them. And I think that basically definitely with a DFC grant, you have your needs assessment, right? And you have all of your goals that you're working on, and you have your objectives and your strategies. So if your social norms marketing campaign is one of your strategies in your grant, or you're going to be doing it under a different grant, that's fine too. But the first place to start is, what are those goals and objectives, and how do you build a social norms marketing campaign to your objectives? So I don't know what you're like. Do you have like a 30-day? What would be some examples around the goals that you're doing in Danbury?
So I know part of our grant, and hopefully I'm answering this question appropriately, part of our grant is to bring awareness and attention and education in regards to cannabis use, vaping, and alcohol use. So since I've started, we have been facilitating some presentations for school staff, for students as well, and outreaching to our communities of color, specifically our elders who are who are raising our youth and children. So some of my goals might be a little bit different from the grant goal objectives, but what we've been doing is really around the issues of vaping, cannabis, and alcohol use.
Okay, so then you would want to build a social norms marketing campaign around those substances and target populations. It sounds like your target populations are youth and possibly parents.
Yes.
Right. So you would have, just out of the top of my head, I mean, obviously we can do TA around all of this, but you would target your messaging. Maybe you're going to have a certain set of items that you're going to do for youth, and you're going to have a certain set of items that you would be doing for parents, right? So maybe you're going to do a parent panel. Maybe you're going to do a film screening for parents with a parent panel, you're going to do some evaluation work around that. And then maybe for kids, you're going to have them do a PSA, or you're going to have them create, Instagram posts or social media posts using the data from your needs assessment. So I know when I was doing mine, I pulled out of my student survey data or my parent survey data, and I would use that data in my campaign. So I would say, something like, just make up a number or whatever, 52%, of high school seniors are, report using substance use. That means 49% are not, right? You're kind of trying to like dispel some of those misconceptions that people see and focusing on some of the positives as well. So always encouraging when you start out is you have your objectives and your goals, and to tie all of your activities around those, using that baseline and then that change over time. So I hope that
So
makes sense.
It's interesting that you say that, because the prevention language is new to me. So I think we are doing some of that. We use some of the surveys that was conducted by a coalition member. And we created bus tails. So in November, I had bus tails put on in regards to alcohol use and the percentages coming back from the surveys. And we're still trying to gather data from the student survey, but we have some stuff we're using last year about cannabis use, and it was like 46 or 85. I'm sorry, I'm a little bit foggy right now, but whatever the percentages of numbers are, we're hoping to do a billboard for that. So I think that's somewhat, once again, I'm not very schooled and up to date with the prevention language, but I think we're doing some of it without me being aware of all of the
You're doing it even though you don't know you're doing it.
Yeah,
That's what we
hopefully.
Yeah,
I have a question for you, Jennifer.
sure.
Because Elke just identified perhaps up to 3 different substance use problems. And, the underage drinking, the cannabis, vaping, which could be cannabis too.
Right.
So, and one of the sort of key principles that you were advocating in your presentation was keep it simple, select, so you don't want to talk about all 3 of those things at once. And you also probably have limited resources. So, that points to me suggests that you need to prioritize.
Yeah, you need to prioritize and also look at your calendar and make sure that you're not bombarding everyone all in February and nothing in May, and to definitely focus, because you're right. You don't want to have everyone get confused with what you're trying to do, or to say, maybe you're going to have 12 months. People aren't around in August, so forget that month. And you're going to say for 2 months, we're going to do something that's really targeted around vaping. And then we're going to talk about marijuana. And then so that you've got this role going, that happens and almost becomes expected in the community. Or you can be doing things all at the same time. Like you said, vaping and marijuana can be together at the same time as well. So, but definitely you might be targeting different populations with different messaging. So if you're going to be working on 3 different substances, you lead with your data, right? You lead with what your data say. I'm sure it's not the same for all 3 of those. Might not necessarily be the same populations either. So the important thing is to not get overwhelmed with just the fact that you're working on 3 different substances, which is a lot, I understand, but to really go back to your data to start out point in terms of, for underage drinking, who are we trying to talk to and what is the behavior change, and take it from there. From vaping, who are we trying to talk to? What is the change we want to see, and go from there. And for marijuana, cannabis use, who are we trying to reach? And, hey, the new law too, people are starting to work in merchants around that. Like, how are we going to bring in any possible merchants in our communities into our prevention efforts? Like, people have brought in liquor resale establishments into their prevention campaigns. So they have literally gone out to the liquor stores and shared with them what they're trying to do. And they hand out prevention material when they make sales. So incorporating all of these key stakeholders. So I would say you just really have to focus and not get one day, overwhelmed too much, but really prioritize the goals that you're trying to change in each of those substances with those populations. I hope that answers the question.
Yeah, no, yeah, and I'm happy to address that. I have sort of another question, and one, I guess, that's pointed towards Elke as well, is, you know, certainly the SPIF process assumes a needs assessment, and you've organized the whole campaign around data, being data informed as well. But not all communities are rich in data. And Elke just mentioned one of the coalition members conducted a survey, and you've also, in your presentation, almost assumed that there's a repeat, a pre-post sort of assessment, so you can measure change in some of those sort of targeted behaviors or attitudes that you're looking at. So I think that Elke has to look at the data she has and whether it can indeed or will be indeed replicated after the fact. Can she rely upon that? And that's going to drive sort of the metrics she's going to be using as well.
Exactly. Well said, Louis.
Yeah, we've been depending a lot on the schools to facilitate the surveys, and because I can't speak for other schools, although I'm going to assume, you know, the Danbury public school system is really struggling right now in regards to a lot of mental health and crisis. So they haven't been able to facilitate the survey for this fall. You know, so the next step, I'm assuming, is doing more outreach and like focus groups to see what kind of information we can get. So for us, starting youth councils at every different high school in Danbury was important as well, you know, to see if there's another avenue. But I saw one of the surveys from last year or the year before just to kind of take a look, and it was just so interesting just to read a lot of the data and you know, what some of the coalition members did, you know, in regards to the data they received. It was really, really interesting, and I'm excited to learn more about that.
Yeah, and you know, having data that's a year or two old is not a problem. You know, most coalitions are not surveying every year. They're on a 2 or 3 year cycle. So certainly if you have 2020 or 2021 data that is sufficient to build a campaign off of, you can also supplement, like you said, with getting some focus groups or key informant interviews, or just maybe putting out a parent survey or something like that. But don't be worried about data that might be a year or two old, and identify, because that's also what's undergirding your grant anyway, right? That's the information that is in the grant. So that's tied to your objectives, activities, and strategies that are already in that DFC grant. So so not to worry about that.
Okay.
What do you think? We went over some pitfalls and challenges, Elke. Like, I'd like to spend a little bit of time on what you think might be some challenges that you might face, so that we can maybe brainstorm, Jane and I, around ways that we may be able to overcome any barriers or challenges you might think you might have. So I know you mentioned that schools are pretty tied up right now. Certainly you don't need to rely on schools to do a campaign, but just any other challenges you see right now.
Well, you know, you mentioned something that I didn't even think about in regards to including like city officials, or letting the city know what's going on in regards to the campaign. And I think trying to have folks get involved when the current crisis, and this is just my opinion, once again, this is you know, a learning avenue for me right now, but I think because there's so much focus on the pandemic and a resurgence of that,
Yep.
Trying to get folks involved in what's going on in regards to substance use prevention has been a little bit challenging. I've invited some city officials the last few coalition meetings we've had and sent emails without any responses.
Yep.
And I don't think the responses are intentional. I just think it's just so
Right.
overwhelming. We've had a surge of violence and community violence in our city, so that's take precedence over that.
Mhm.
We've to get law enforcement engaged has been difficult as well, because of the increase of violence within the schools and all of that and some other stuff. So I see, and I wasn't thinking about that until I'm thinking, oh, I want to do a campaign, but obviously to notify or to involve our city in that is essential, right? So I have a couple of ideas about billboards, and I didn't even think about involving folks in the community, but I guess if I do, how do I go about doing that when I think everyone's just burnt out, I think we weren't waiting for 2022. We're waiting for like a whole new decade to come,
So, right. So, one is you're providing the opportunity for people to be around the table for those who can. It's important to always, at least I felt when I was a coordinator, to say, hey, I let you know, you were informed, you were invited, whether or not they can make it or not. Sometimes people just read the information without necessarily responding. I wouldn't necessarily take no responses. They don't know what's going on. Maybe they're just too busy to respond or attend. But again, it's you just making those opportunities available, whether they are able to capitalize them or not. But also, I think that I have flipped this messaging around, is instead of it seeming like you're asking them to come to your meeting, you're asking them to help you. The messaging more is around, we're going to help you address school violence. We're going to help you address the mental health issues that our kids are facing during the times of COVID through X, Y, and Z. It's what you are bringing to the table to help in collaboration with them. Because sometimes we fall into this, we're always asking people to like, come to the coalition or help us do this or help us do that. And it's more about how we are going to help you. How are you going to help the school system? How are you going to help the city? How are you going to help the community? If that makes sense.
Yeah, that actually does. I like that wording. Thank you.
Yep. So, yeah, you're having a hard time with student mental health right now because of COVID or whatever. Here are 5 things that the coalition is working on, and we're going to do a campaign around that. We'd really love for you to partner with us in order to address this issue with you. And we can help alleviate some of the work that you're needing to do right now by letting the coalition take on some of that. So I hope that's helpful.
Thank you. Is there like some kind of outline or some additional information in regards to some of the challenges that I could read up on or have some access to?
So what do you like, barriers or challenges to overcome? Not really. I mean, in terms of what that is, we do 12 sector presentations that are on our YouTube channel, like engaging the enforcement sector, engaging the youth sector, engaging the parent sector, engaging the school sector. So those are all been trainings that we've done. You can watch them all on our YouTube channel. That does get into challenges of engaging certain sectors. We haven't gotten to the government sector yet. That was supposed to be today, but I decided this was really more important to our coordinators right now to start building these evidence-based strategies, because people are working on implementation right now and planning and for the rest of this year. So I wanted to bump out a little bit of the government sector, but we could also do TA, and I can walk through things with you too, just through my own experience, or Lisa or anyone else who's done them before. And also we can also connect you with other people from other coalitions that have done them too, to walk through some of those challenges. So I'm happy to have an offline conversation around those, and then also connect you with other people.
Okay, what does TA stand for?
Oh, sorry, technical assistance.
Got it. Thank you. Thank you.
TCASC is the Training and Technical Assistance Service Center. So we fall under the Department of Mental Health and Addiction Services too, and we help coalitions with TA, technical assistance, like how you're doing things, challenges you're facing, how to implement plans, things like that. So we do trainings, a lot of trainings, but we also do individual kind of one-on-one technical assistance that you might need as well.
Got it. Thank you.
And Elke, I should probably speak up here too. I am the director of the Center for Prevention, Evaluation, and Statistics, CPES, which is another resource that is funded by the Department of Mental Health and Addiction Services. And we're specifically charged with sort of data in the state and doing evaluation and all. And just as Jennifer said, that TTask is a resource. We too are a resource when you have questions about data for needs assessment or evaluation.
Thank you.
Yeah. Okay. Anything else? Trying to think of some big tips at this point. I think we're going out. Bye.
Okay. Okay.
And feel better, Elke.
Yeah, feel better.
Okay.
Welcome back, everybody. All right, we're going to take a few minutes. I'm going to pick on people, so be ready to just talk about some things that you learned or shared, ongoing challenges, questions from your breakout session. So let's see. Let me go with Mallory. Are you there?
Yeah, I'm sorry. Having a snack.
Oh, sorry.
Hold on, actually. Maybe I'll come back to me.
Yeah, let me go. I'll come back to you. How about Ty? You want to share something from your group around goals or activities, challenges, just any big takeaways from your breakout session?
Sure. So actually during my breakout session, I took up all the time. I'm sorry, guys, again. But I talked about a social norms campaign that my community recently did for Christmas and New Year's. We recorded a holiday jingle sung to Jingle Bells. Just talking about it was directed more towards like adults on not providing alcohol to kids during the holiday season. We even mentioned the social host law, how you should talk to kids while they're young. And then we went forward and we produced, thank you, and we produced actually a video and we put it on Facebook, and we also did this thing called Over the Top Media, where if someone was watching, like, let's say Hulu or Spotify online, and then for those commercial breaks that you have, you would have a local commercial, and the local commercial would show actually our video. So that was ran for the OTT, or Over the Top Media, and Facebook campaigns were ran for 3 weeks, and we had, for Facebook alone, we had over 14,000 views. And then that drove traffic to our website. So, and then we have lots of information on underage drinking and social host law and so forth. So that's something that we did recently. And I actually put the link to the video in the chat box so everyone can see.
Thank you. Awesome, Ty.
Thank you.
How about Carolyn? Are you there?
Hi, I'm here. Yes. So I was in a group with, let's see here, hold on, Taylor and Stephanie, and we had a nice conversation. We were talking about local campaigns, future campaigns, and some of the big state campaigns. So we got to really look at multiple things. And I just want to give a shout out to Ty. Your video is amazing, by the way. I was sharing that all over the place. Great job. You know, I sort of told a story about sort of when I first started working in prevention, some of the exposure that I got to social norming campaigns and the education that goes behind it, and the process of why sometimes it's really good to educate your target audience. So like for us, we were doing social norming with survey data and with youth. And sometimes, and I know some people will understand that sometimes there's pushback when you like talk about the data, like the kids don't buy it. They're like, what do you mean? Like 9 out of 10, like, you know, sometimes they just, so you have to educate them about, like, we do the survey every 2 years, it's anonymous, you know, it's good to do some of that education because it builds the buy-in. So they're not just, you know, disregarding it And another fun thing that we did, and this was a long, long time ago, not under my leadership, but we did like this evaluation, this fun evaluation where we were asking the kids, like we did posters in schools. And so we asked them, like, do you remember what the statistics were that you saw? And like, you know, if they did, they got like a little prize. And then also we let them vote on their favorite design. So we had a couple of different designs up, and you know, we let them get a little prize at the time. We could hand out candy at schools. I don't think we're not really supposed to do that anymore, but at the time it was something fun that we did. So there's some really good opportunities, but it's really good to do the fundamentals, you know, I mean, that stuff's important. So we had a really great conversation. Thanks, guys.
Great, thank you. I think we have time for maybe one more. Courtney, do you have anything to share from your group?
Sorry, I was in Ty's group, so
Oh, you were, okay, all
she
right.
killed it. Yeah, her video was awesome.
Sorry. Let's see. Darian, do you have anything?
Yes, so we had a super great conversation in our breakout room, and we were talking about just like the importance of mental health and how that's kind of an underlier in a lot of youth's lives, and kind of the social pressure that's on them, especially when they're heavily involved in athletics, which was similar among the communities of everyone in the breakout room. So we were just kind of talking about ways to address that, and through the like kind of they talk, you listen, and kind of taking that to kind of edit it a little bit and add some things to kind of implement like community and also the importance of talking with your youth. And I had the idea, it was previously used for my coalition, like pizza box messaging, and kind of like either promoting like a fun activity among the family or like a discussion or something along with community events that are like parent and child or family oriented, just to kind of get that message and establish that bond between parents and families to kind of affect the decision-making process of the youth.
Great. So there's a lot of people on the call that have done campaigns before, or some people who have done none. So we just want to reiterate here at TTAS that we can connect people, and you certainly can follow up with any of us in terms of your specific goals and your specific questions and how any specific challenges you may face. So don't feel like when this is all over, you're now off on your own. You know, everyone here is always so helpful to mentor or to answer questions or to be connected. And also certainly TTAS can walk through some of the logic model process or how you might tie things to your goals and objectives too. So just wanted to reiterate that point to everyone going forward. So we're just about out of time. So just want to finish up. What we have on the last slide that you'll get sent is just a resource list that a lot of this was built upon. So the first thing is that we have a TTAS social norms marketing guide, which is really what this presentation was based upon. It's really 2 pages of that really strong research-backed evidence-based strategy of social norms marketing campaign. So that's available on our website right now under our tools section. We're going to be providing you with that presentation logic model template that Lisa went over. So that will be a Word doc that you can literally just print out or work online with and start to utilize if you'd like in helping organize your logic model. And then just other connections to research-backed evidence and to research ideas around social norms marketing campaigns. So you can find other ideas towards that. And then finally, just the last thing I have here is an evaluation link for today's session that I'll post in the chat box if everyone just really wouldn't mind filling that out so we can make sure we're doing a good job by everyone, or ways that we can improve going forward. I would appreciate that. So we do have just a couple last minutes. So if there's any other questions or last comments, happy to take those. Otherwise, we will start to wrap it up. And I just put that survey evaluation link in the chat box for those. But any last minute thoughts, ideas, questions? Where do we go from here? Everyone's good?
Just appreciate everybody sharing the different work, and we understand that people are in different places, you know, in terms of this process. So please reach out to us or to each other. And if you need a name or two, we can connect you.
All right. All right, well, thank you so much for coming today, you guys. We'll be doing other evidence-based strategies trainings coming up in the future around youth engagement and enforcement provisions and capacity building. So you can look out for those as well as we move forward. So thanks so much for coming today, you guys. We'll follow up with all the materials and talk to you soon. Bye.
Bye, everybody.